Welcome to the podcast, Dr. Brown.
Thank you. Thanks for having me. It's been a long time coming. I'm happy to be here.
It definitely has. And I'm not gonna spoil too many surprises, but especially for those residents out there, those medical students, people who are early on in their medical careers considering DPC, take a close listen to today's story. So, Dr. Brown, with that, I wanted to start with your journey into family medicine. On your website, you share in your bio how when you were at medical school in Arizona, it was very quick that you came to the decision that you wanted to practice full scope medicine. So can you tell us a little bit about that journey to choosing family practice as a specialty?
Yeah, of course. So yeah, in med school, then I joined all the clubs first year. I had no family or extended family in medicine. So I didn't have any people pushing me one way or the other or telling me to do something or not in terms of family members. And so I just joined all the clubs. I mean, surgical, non-surgical, everything. And I went all to all the lunch meetings and after hours events and met everybody. Within a few weeks, I gravitated towards the primary care side of things and then quickly onto family medicine as well. I have an entrepreneurial itch that I can't quite scratch, and family medicine seemed to fit the ability to have my own practice, but also to treat all ages, because that's one of the things that I really love too, is womb to tomb, as they say, or whatever fancy saying the AAFP has nowadays. But that really struck a chord with me to be able to open a clinic, treat patients of all ages, and pretty much kind of form my own path in terms of what I really liked. If that was OB, great. If not, or women's health or men's health or you name it, whatever, integrated medicine, whatever. There's pretty much, we all know how great family medicine is. So that's what really turned me on to it initially. And I haven't looked back, haven't second guessed it once.
Awesome. And my alluding in the earlier statement about how if you're a resident or someone early on in your medical career, take a close listen. You recently graduated residency. What gave you the idea that opening a private practice was still going to be a thing, even though you graduated recently yourself?
hmm Yeah, I mean, you nailed it. This is a long answer. I'm going to keep really short, and people who know me will understand it better than the people who are just listening. The American healthcare system is exactly what health insurance wants it to be. Very vague, very no one really knows what's going on. And so, as I learned more about it, and as I went through the various specialties in medical school, and then through rotations in residency as well, I just finished this past summer a few months ago. We all complain about the healthcare system, and I'm guilty of that as well. Usually when I'm really exhausted, but I felt like direct primary care and the people, the mentors, friend tours that I have, they turn me on to the fact that like this is actually doing something to change the American healthcare system, and that's one of the reasons why I love it so much, and why I knew early on that direct primary care was where I wanted to go, because I was tired of complaining and I was tired of hearing everyone complain, including myself. And so I was like, this is my small way of doing something to change. It's really hard to change the whole world, to be Elon Musk or Steve Jobs or whatever, but I can do my part and lift where I stand. And so it really again, it was one more click. Everything kept clicking. We always say, oh, it just clicked. I had a lot of clicks to get to where in my illustrious career where I am now, if I can say that. And that was one of them, to where it's like, hey, I can A, have my own clinic, B, feel like I'm really making a difference in the system as a whole, as well as in my patients' lives. So it was too good to pass up.
Awesome. And I love that term. That's a new one for me, friend tour. I think that's great. Many of us have those mentors as attendings, and even residents older than us who definitely fit that bill of friend tour. So when you were talking with your friend tours, where along that journey did you hear about DPC? Was it because you were having those conversations about the concern for the lack of transparency and the crazy cost of American healthcare?
That is a fantastic question. I don't know if I have a specific point in time where I knew like this is it. I think it was just accumulation of thoughts that I was having that I didn't know I was having, and feelings of there's got to be something better out there. It's a consumer driven country pretty much. Why can't we even, and making money off patients' health just feels slimy as it is. And so the whole hospital administrator thing and all, I just, once you start learning about it, and then once you start talking with other people and bouncing ideas off people that you can trust of various backgrounds and everything, ones in the DPC space and one's not, it just kind of, again, just slowly clicked and started that snowball effect of, this is going to work for me and it's going to work for the country. It's happening. It's not just a movement anymore. We're here to stay type of thing. And then during residency, I was very thankful to have a program that allowed me the bandwidth to explore that and kind of see if that could be a possibility. And then it was very fortuitous that it kind of happened during residency, which was almost to ask forgiveness rather than permission when it came out to it. But in the end, it was fantastic. And I mean, it's just exploding from here.
Love that. And can't agree more that this is not, a grassroots movement that is going to go away anytime soon. So when drop that amazing part of your history that you opened Strive Direct Health during residency, your practice is with Dr. Sarah Schuster. And I'm assuming she's a co-resident of yours as
She
well.
was, yeah.
Yep.
Yeah.
So can you share how on earth did you go from this, this is definitely what I'm going to do. I'm going to be a DPC physician, to actively putting the steps in place, and then, like you said, asking for forgiveness rather than permission. But how did that all culminate in you guys opening and you guys working together to open Strive Direct Health?
This is a fantastic story. So about, I don't know, halfway through residency, months in or so, then I was driving home post call. I think I delivered 8 or 10 babies that night. I was exhausted, and there just happened to be an office space, the one I'm in right now, and that was brand new. It was a dirt floor, and I literally like looked in the window, and the real estate agent was here, and so he let me in, and we just started talking. I was in a dissociative state. I didn't know what was going on, and I told him a little bit about what I was thinking about doing. He's like, "Oh, that's cool." And that was like the first thing. I was like, yeah, that'd be a perfect space. It's 1 mile from my house. It's only a couple miles from where I'm doing residency. It was almost the right place at the wrong time. And so I was like, oh, well, it's 18 months away. I'm just gonna have to let that one go. There's gonna be other office spaces. It's no big deal. And then as I got to thinking about it more after a nice nap, then I was like, you know what, that is the right place at the wrong time. And all of my colleagues are signing these 6-figure contracts months before they're financially secure. That's debatable, but they're 2, 3, 4, $500,000 contracts. And after residency, I'm starting from scratch at zero, pretty much. So maybe I could start getting a little bit of the momentum before patients sign up in July of 2022, and actually have the groundwork laid to where I can just hit the gas and just say, okay, everything, I don't have to worry about anything. Let's just start seeing patients. And as I was bouncing those ideas off Sarah, she was like, oh man, this is awesome. And she started drinking the DPC Kool-Aid. And I was like, hey, we should just do it together. Like, why don't you let's just do it. She was all in from day one as well. And so it actually made it easier with both of us, because during residency, if it was easier to have 2 instead of 1 in case a patient needed anything. And anyway, my wife designed this office, we built it, and then they put a big sign up, the landlord did, that, hey, coming soon, a new doctor to the town. And I was like, oh crap, this is not supposed to be working like this. And then people started asking and signing up like crazy. And I went to my program director, and he was like, I'll just log them as moonlighting hours, I guess. So it was actually pretty cool. We had very fortunate. We had 100 patients with 100 days left in residency. And so it was kind of a cool stat that it hit right at that mark. And then once residency was over, we took a couple weeks. Both of us took a couple weeks off just to recharge, and then now we've just been going at it. It's an absolute blast. It's really, really fun.
Awesome. And when I've talked to residents in the past, one of their biggest concerns is financially how to go from residency to DPC. Like you shared, your classmates were getting into these 6-figure potential golden handcuff type of situations, and you chose to open. What advice would you give to people who are very much considering doing DPC right out of residency as well?
Yeah, that is a really good question. And I'm not quite in the mentor level yet. I feel like that's a question for a mentor, But I would say, one of my friend mentors, he always says, you do you. He says, just block out what all the haters say and just you do what you do, and you be you as well. And it's like, okay, I'm going to do it anyway. I'm going to be 50 when I'm 50 anyway. Might as well be doing something I love and something I want to do. Why wait? Why get in those golden handcuffs? I was lucky enough to find a couple decent moonlighting gigs that help pay the bills while we're growing. And that's common. I've been part of the DPC Docs Facebook group since second year of med school. It's kind of snuck in, but just pouring over all the advice, just being a stalker on there and pouring over the advice. What is other people doing? And you've seen one DPC clinic, you've seen me one, which gave me hope. Like I can kind of do it my own way with the I guess the blueprint of what other people kind of do. And it's been, obviously it's been hard. I'm not going to say that it hasn't been, but it's been more than rewarding. And you feel like you're truly working for something, and not just you're not just going to work. Like, I love coming here. I walk in not every day. I wish I should every day, but I get up in the morning. It's like, this is what I want to do. It's awesome. And I love it. And I could be offered maybe billions. I'd take it. Millions of dollars. I wouldn't sell Strive. $1 billion, I probably would, but millions, no. But the advice I would give is just go for it. I mean, it's easier as a resident because you're already making pennies. So it's easier to lose pennies than lose hundreds of thousands of dollars. So.
And that is definitely sage advice. So, and especially these days when, especially after the pandemic, people are really thinking about career choice differently than we previously did as a culture, I feel. So when you had taken particular jobs to fund your practice, how did you and Sarah go into it together in terms of legally? Does she work for you? Do you work for her? Are you guys both partners legally? How have you guys set up the partnership on the legal end?
Yeah, that definitely goes back to the once you've seen one, you've seen one phrase. And so, I mean, she's like my sister. We're like brother, sister. And so we have had great conversations and we have an awesome relationship. I mean, I hope we do. I mean, hopefully after this episode, if she listens to it, she's like, no, no, I'm just kidding. She early on said, hey, you run the business. She said, I would love to just be an employee. I would love to have that be, because she recently, I mean, she teaches at the residency. She does some moonlighting too. She wanted the flexibility to kind of wear a bunch of different hats, and being a mother is one of them. And this kind of lets her wear those 4 or 5 different hats. So I said, sure. So we structured it to where I own Strive, and she's actually a W-2 employee. And then there was the question, which has been the logical next question: what about patients when they sign up? Because everyone is always asking, how do you patients, blah blah blah, how do you split them? And we decided we don't want his and hers patients. She doesn't get a piece of the income of whatever. I said, I'll pay you a salary, and your salary grows based on how many patients we have. And then whoever signs up, they're Strive's patients. And our value prop to them is you have 2 doctors in your pocket. It's Dr. Brown, Dr. Schuster, Dr. B, and Dr. S, male and female doctor. She's an MD, I'm a DO. I'm really tall, she's less tall. And so it's like, we're a really good balance, and patients love that. Hey, I have a question for Dr. S. They'll shoot us a text. Hey, I have a question for Dr. B. Shoot me a text. And so we've seen that all of our patients love the ability that they're like, I have 2 primary care docs in my pocket. I can text at all times instead of having to choose, they're seeing one or the other. And it's been pretty seamless. And so we set it up that way, and it's working really well so far. We haven't had any issues with it. And so when people ask on the DPC Docs Facebook page, I always like, this is how we do it. And people are like, what? How is that even possible? It's like, well, once you've seen one, you've seen one. It's working for us for now. So whatever.
And just going back a little bit to the financial question, when you were deciding that this is how, it was going to be set up between the 2 of you, and you had this space with a dirt floor, and you were opening, and you were doing these moonlighting gigs to help fund the DPC, how did you targetedly put your money towards certain pockets, whether it be to pay her salary or to pay the build out, so that you had everything in place after you graduated residency and after you took those 2 weeks off?
Yeah, I should show you my spreadsheet. Yeah, it was a lot of conversations. They actually moved in, her and her husband moved in right around the corner from us. So we're basically neighbors as well. And we had had them over for dinner. They had us over for dinner. And even during residency, when we were on the inpatient service together, it's all we talked about. People just rolled their eyes whenever we were around because they knew it was so ridiculous. But the moonlighting gigs I had, they paid pretty decently well. And so I would just 1099 myself and had everything run. I still do everything run through the Strive account. And so it's all income for my Strive LLC. And then that money gets divvied up between the build out loan, I guess, her salary, and then expenses as well. And so it was just pretty much everything I made outside of my residency salary went into the Strive account, and then it just got divvied up as it needed. That's the short answer without pulling up the
spreadsheet.
Yeah, not so complex spreadsheet in my mind, but yeah.
Love it. Love it. And then in terms of, again, going back to how you talked to your residency director about, classifying this as moonlighting, when you had your very first patient, how did you manage that in terms of your patient's care while still being a resident?
Yeah, I still remember my first patient's name and date of birth. Obviously, I'm not going to say it here, but it was very humbling when someone signed up and paid and put in their payment information And like, I still remember that feeling. I still get that feeling, but that first one was very humbling. And so I made sure that all the patients knew, hey, we're available. You have the unrestricted access. Shoot us a text or a call, and then they don't get a phone tree to a triage. I can triage it. And so I told them that I still do have other responsibilities as well. And so if I'm not immediately available, that's okay. And there's very few things that you immediately need to be seen for. And if that is the case, you probably need to go to the ER anyway. And that was kind of my 2-second pitch to patients. But it was a lot of running up here on my lunch break into the clinic to see a patient real quick, or on my way home, or after hours, weekends type of things. I wouldn't say a lot, but I just did it. You just have to do it when you're running your own clinic. So, but once residency ended, it almost felt like I was losing one full-time job, so I could just continue my other full-time job and another one. I think there was only one time where a patient was a little cranky about not being able to be seen within the hour for a stubbed toe or something. But other than that, patients are very respectful of your time when they're paying you their own money. When it's not third-party payer, they're very respectful for the vast majority. And yeah, we've never had an issue with it.
And how did you guys market in addition to, the realtor putting out a sign that a new doctor was going to be in town?
Yeah, well, 100 patients with 100 days left in residency. That was the shocking part. That was like a realization, like, oh my gosh, this is actually growing some legs. And the momentum has started a long time before we were even done, but it was all word of mouth. I mean, we have a couple Google ads and Facebook ads, but those have been zero ROI. I'm still curious about, you hear it's the volume game. I mean, it's all about FaceTime. So the local market, the local networking groups we go to, we do, BNI meetings, chamber meetings, and things like that. I was just at a local Girl Scout brownies meeting, taught them some first aid. They taught me a lot of first aid too. But things like that, just getting your name and face out in the community, because sure, we're selling primary care, but we're really selling trust. And that's what it is having patients have someone that they can truly trust to come to when they're vulnerable, when they're sick, and that's a very vulnerable time. And so instead of just my face and Sarah's face on a Facebook ad, getting out there and like shaking their hand and seeing like, hey, I'm a human, I have a family, I live a mile down the road, Sarah lives a mile that way. And so we're local residents as well. And we're here for the community. And that's been the biggest ROI. And it's not about that. We genuinely love doing that. I love meeting with people. I'm an extrovert, and I could do that stuff all day. So paid marketing has been not very fruitful. It's all about just putting the time and the consistent effort into it.
Gotcha. And in terms of Colorado compared to other states, Colorado definitely is a DPC hotbed, which is awesome. And more states are achieving that. But in terms of the value proposition that you guys had experienced from what your patients were telling you, what your patients were telling you they needed, and you were developing your copy for your website and these ads that you did put out, what was it that helped you narrow down your message for when you were talking quickly with BNI group or just meeting someone at the marketplace?
Yeah. I mean, as a lot of your listeners know, it just takes repetition to get that elevator pitch down, to get that back of the envelope pitch down. I was lucky enough to find DPC early on, and I've heard a lot of DPC docs give theirs. And so I kind of just copied and pasted theirs that fit, and then kind of fit my style, my vibe, if you will. And I looked at like every single possible DPC website. I love Paul Thomas's website. I used the first website I had, I kind of formed out off of his. And I looked at everyone else's too, not to give him a shout out, and then just kind of pick and chose what I liked and then kind of put it on the website. And then my wife was like, yeah, no, that doesn't make any sense. I'm like, okay, then I have to change that. She was kind of the editor in chief, but it's just takes practice. You have to get out there and actually say the words and hear yourself say them and realize that doesn't make any sense, or that makes perfect sense in my mind because I'm a doctor, but I'm not talking to doctors. I'm talking to local small business owners, or I'm talking to my family or something. So it just takes, again, consistent practice to get that pitch down. And my family, they all just walk out of the room. There's 5 siblings, and they all just leave whenever I start talking about DPC. They're like, all right, we've heard it enough. Like, it's whatever. But getting as many sounding boards as possible and practicing is pretty much just what I did.
Awesome. And as you've shared, you developed your website, you adjusted your website as needed. Did you also develop your logo as well?
Yeah, well, funny story. So I paid a few different people on like Fiverr and all the little sites and everything, and I think I spent like 100 or $200, not that much at all, to try to get a cool website. You know, they always ask for, what do you want? I don't know what I want. You should tell me what I want. And my sister, she's the creative sibling. She's my oldest sister in St. Louis. She's a very well-known wedding photographer. And so I texted her, I said, hey, help me out with the logo. And it was while she was cooking dinner on her phone that she has 4 kids, 4 young kids. And she did it on Canva real quick and she's like, all right. She was like, just stop texting me. And I was like, well, that's the one. I knew right away when she sent it to me, that's the one. And so it's a lame story. It's not very reproducible for anyone else who's out there, but it worked for us. And in Colorado, our logo is a ponderosa pine for Strive. And so when you go up in the Colorado mountains, they're everywhere and they smell fantastic. And so we kind of built the whole brand around that.
And can you give the audience a little bit of the history as to Strive itself? How did you choose the
Oh,
name?
so it took like 2 or 3 years. Honestly, we had the luxury of time because I knew I wanted to open my own clinic when I was in med school. So I wasn't pressed for time. I didn't put in my 90 days notice or anything like a lot of docs do, you know? And so my wife and we had a list on a Google Doc that we shared on our phones. And we just, anytime we thought of something, we just put it on there. And then I swear it was like every night we were going over it. And then I like had all the definitions and I made sure I Googled and made sure there wasn't other clinics with that name. And then I love just the definition of strive. I love the idea of striving for something because, you know, we're always climbing a mountain, but what is the summit? We don't know. You don't know, okay, now I'm healthy. It's like, that doesn't make any sense. There's always something we can work on, whether that's with our health or not. There's always something that we can be better at. We can always be better people. We can always be better husband, father, whatever, friend. But I don't know who actually came up with Strive. It's on our list. We should look at the edits of that Google Doc and see who actually wrote it first. But it clicked and it worked with the logo. It was like the principle behind it. It just was too good to pass up. And so we got the LLC formed, and then within like a week, we found out that there's a Strive Health here in Denver that's actually a nephrology clinic. And so we're Strive Direct Health. And we literally did our LLCs like at the same time. They're not a direct care model. They're just like a normal fee-for-service nephrology clinic. And so I've called them a couple times and we chuckle that it happened at the same time. But Strive Direct Health, you got to have the direct in there.
Perfect. And you're directly caring for your patients. So that's
Yeah.
awesome. And did anybody take that to the federal trademark level?
No, not yet. Knock on wood. I'm just kidding. No, we should definitely get there, but we just haven't yet.
Gotcha. And I'm going back to just your guys' ability to create copy and pull from the verbiage that you've heard from the community and your everyday experience with patients, as well as you mentioned your sister has 4 kids, you have 3 yourself.
Uh-huh.
And one of the things that I noticed on your website that there is a lot of chatter about is the usage of the access 24/7. So
Mhm.
how do you, because I know you shared how you balanced having patient care while being a resident. How do you offer access 24/7 and balance time with your family and your kids?
Yeah, that's the never ending question, right? My main view on balance is I really don't love that word because it inherently implies that you have to give up something else to have something. And so whether this doesn't, I don't know if this is going to make sense, but I think of it more as harmony. So if you play a 6-string guitar, sometimes a chord, sometimes a different chord, it just sounds different. And so if you have, let's just say 6 things in your life, family, religion, job, whatever it is. And sometimes you just have to play a different chord. And so residency was obviously heavy on my career, if you will, and med school. And so we had to play that chord. And then once Strive got up and running, and then Aero as well, you just have to adjust your harmony. But in terms of the kids, I mean, I identify as a father first, a husband second, a doctor third. And I tell everyone who, again, people roll their eyes at that. And so my patients know that. I have pictures of my kids all over the office. And Sarah just had her first as well. And so it's a lot when new patients sign up. It is definitely some training. People sign up for a reason. They don't just sign up because it's a good idea. They sign up, hey, I need to be seen or something. So that first month is usually a fair amount of visits or communications or patient touches, if you will. And so I always tell them my 2-second pitch is, hey, if it's urgent, give us a call. We always call back as soon as we can. If it can wait a few hours, shoot us a text, and then we respond as soon as we can. If it can wait a couple business days, throw it in an email. A young mom who emailed me a picture of her son's arm. He had just fallen off his bike, and it was like at a right angle, and it was clearly broken. And I didn't see it for a day. And I was like, okay, I need to do a little bit of patient training here. It sounds common sense to us as physicians, but as a first-time parent, like I was a first-time parent at some point, and I was in med school, and I still didn't know anything. So it is just patient training to get them for that unrestricted access. I fall on the line of, I don't say unlimited, I say unrestricted, just because unlimited, I feel like there can be definitely some interpretation there. But with the two of us, with Sarah and I, then one of us holds the phone after hours, if you will. Our system can forward the number to wherever we want. So they know that, hey, I'm not going to call you at 8 p.m. if my kid has stubbed their toe or something, but we tell them, hey, if you think your child is getting sick, or you think you're getting sick, call us at 8 p.m. as opposed to 2 a.m. But we have yet to get a call between the hours of probably 6 p.m. and 7 a.m. So, and it's been 18 months. So it's just patient training.
And with your time since graduating residency in practice, when the whole family is going on vacation, do you take your calls still while on vacation, or do you sign out completely to Sarah?
Depends, either or. I mean, we haven't gone like on an international trip or anything, but my wife and I, we went on an anniversary trip to Mexico this summer. And usually, I mean, Sarah is much more intelligent and brighter than I am. And so I have no problem saying, hey, Sarah, here's the phone. It's just 2 clicks in our system to have it forward to her. And so usually we just take weeks. Like I answer all the calls and the texts 1 week, and then she does the next week, and we just bounce back and forth. And so the vacations are just on one of our off weeks, if you will, whoever's not on the phone. So she goes as well. And if there's anything that the patient's like, hey, I have a question specific for Dr. S, and then usually I'll just text her and be like, hey, do you want to answer this, or are you like off the grid? It's a good working relationship. And again, it's a moving target. She and I talk once a week. We're like, hey, is this workflow working? Do we need to adjust this? Do we need to like sign out completely? But I did answer one text from a beach in Cancun this summer just to say that I did, but I quickly got my phone taken away from me by my wife. She was like, no, we're on vacation. You're not doing that. I was like, all right, fine. I'm fine with that. So yeah, it's really nice having both of us because we can take a vacation. I know that's pretty unique. A lot of docs starting off are just by themselves. And that's the number one question. You're on call 24/7. How do you do that? So we're pretty spoiled in that way, but I sign everything out to her. She signs it all off to me. And it's a really easy way to do it.
And now you mentioned workflows. So I want to bring in here, and you mentioned it earlier, that one of the hats that you've worn during your journey is also being one of the co-founders of Aerodpc. And so this baby Aerodpc, can you share with people who might not be aware, what is Aerodpc? And
Sure.
in terms of the workflows, I definitely want to get into how your clinic has been able to adjust, because you were creating your EMR as you were running your clinic and the everyday experience there. So please tell us a little bit about Aero.
Sure. Yeah. So back in med school, I was rotating. Once I knew I wanted to do DPC, I found a doc in Phoenix, and he's one of my friend tours now, Kirby Farnsworth. But he had a well-established practice, 700 patients. He was only a few years out of residency, so we were similar in age and phase of life, so we're still pretty good friends. And he was using a well-known system, which I will remain nameless on this podcast. And as a med student, I wanted to impress and get a good grade and make my notes look pretty. I found I was struggling through those workflows. And my brother at that time was a software engineer at Amazon. And later that day, I called him and I was like, hey, can we just build one for me and my practice? Because I don't want to struggle through all the other ones. It'd be something professionally we could work on together, because he's in software engineering and I'm in medicine, for crying out loud. And so he started tinkering around in his free time, and it was, oh, that's fun. And then residency started, and I didn't have much time intern year. And then halfway through intern year, he actually quit Amazon to go full time on Aero, because we felt like this could actually go somewhere. Then my wife started working full time on it, Danny. She has her MBA, and Kyle did all the development. I did all the demos, and then she did everything else on top of everything else she did too. And so it was pretty much while we were building this office, then Aero really started taking off like a rocket. We did a demo early on with you. It was very early on, and I remember thinking, in those early demos, I'm like, man, this is cool that we're getting demos, but I don't know if we're quite ready to actually onboard real life practices yet. And our user one, I guess technically I'm user 0. User 1 was Kirby and his practice, and he wanted on it. And then from that point on, in the last year, year plus, it's taken off like a rocket, and we're like barely hanging on to the fins, trying to steer this thing and build it as it flies. And so the workflows in Strive are pretty easy because I know the inner workings of Aero, and like I know what is being worked on. And so I know I've seen it in every single iteration, so I know how to use it. I told my brother, I said, here's what an EMR needs. This is at the very beginning. I'm not going to show you any EMRs because he's never seen one. I want you to build it as if someone in the tech world would build with these requirements. I don't want a paper chart put on a screen, because that's, in my mind, that's how they all are. I know it's whatever, debatable, but I don't want a paper chart with a bunch of tabs and all these things and all these words and busyness. I want it to be built for what we have, the technology we have today, and the technology for 2030, 2040, 2050. And he said, okay, yeah. And there's been some times when like, I've had to say, hey, doctors don't think that way. They need it this way. Like how labs are viewed, the first iteration of that, I was like, this is awesome. I can see why you did it this way, but this is not how we think at all. So we need to like actually do it the old fashioned way. And so workflows, I mean, we've come a long way since our demo, Marielle, but it's really, really fun to hop on a call, hop on a phone with someone who said, hey, can we do this? And then we roll it out. And it's like really, really fun. Kyle's going to hate me for saying that on the air, but because it's a lot of work for him, but to be a living, breathing tech organism, if you will, to where doctors feel like they have some say and some ownership in it is really, really cool, to where they can help build it, because I'm only one physician, and I'm a tall white male physician who thinks in one way in Excel spreadsheets, because that's what all of us men think in. And so having other stakeholders to where they can help build this airplane while we fly it has been an unexpected joy of Aero, to be able to talk to so many different people. It's been a lot of fun.
I just love it. And it goes back to, you called yourself an entrepreneur at heart who is always thinking and dreaming of how to serve your community. And so this is serving not only your patients, but also the greater DPC community. And recently, a very exciting change has happened at Aero. So can you share with the audience that might not know what has happened recently with regards to Aero and its ability to impact direct primary cares all over the nation?
Yeah, of course. So in 2 days from the day of recording today, I guess it's a couple weeks ago for people listening now, Aero has officially been acquired by Hint Health, and they've been looking at either developing or purchasing an EMR piece for their product line. And there, we are very mission aligned. We wanted everything a DPC doctor needs in one innovative platform, is our kind of tagline, as well as being a part of changing the healthcare system. And obviously Zach and the whole Hint team, have a very similar vein of thought. And so Zach actually cold called me this summer, wanting just to meet. And I'd never spoken with him before. He was like, oh, you guys are new kids on the block. This is right when things were absolutely exploding with Aero. And then we just started chatting, and push comes to shove, which there was none of that. But we're here today. It's been fantastic. It has been a match made in heaven so far. And we feel that this can really be something that really changes a paradigm for a lot of people, to where it's a one-stop end-to-end solution, to where the people who are considering switching, it makes it as easy as possible. The people who are already in Aero, in the direct primary care world, they can have a whole line of products, everything from Hint Connect to Hint EMR, whatever it ends up being called, to Hint OS, and have it truly end to end, everything you need in one, without having to open a bunch of windows and a bunch of different logins. It's going to springboard the whole movement, but also have a one-stop shop. So it's already been awesome. It's also been extremely professionally rewarding in the few weeks that we've been officially working with them. But it really is a match made in heaven.
I love it. And I get so tickled with this story, because you were really just doing what you loved. And that wasn't even on, like you said, Zach cold called you, but it wasn't even on the radar. And it makes me think about when a patient randomly will cold call your practice and be like, I want to join. And it's just like, you're just doing what you love every day. And then all of a sudden it means something to somebody. So I think that's so awesome. And going forward into the future, and because Danny, yourself, your brother have created this product from the ground up, what is your involvement as a team working with Aerodpc as it goes into the future, as it's been acquired by Hint Health?
Before I even answer that question, I have to say that it's been a full family thing for Aero. even my dad, who's been a CEO of massive companies my whole life, he's been like our elder statesman, and at times definitely angel investor to help us get through, which now, I mean, it seems like pennies, like we're bootstrapping it, for crying out loud. We didn't go raise VC funds or anything for Aero. And having him being like, okay, I have 40 years of experience, you guys should not do this. And I'm like, okay, well, it seemed like a good idea. So it's been the four of us, and then we hired another guy as well. And so it's been a lot of fun to professionally be able to work with my wife, my brother, and my dad. So I mean, I haven't done much of the development. I do all the demos. I'm a demo guy for Aero, just a doctor, for crying out loud. But being able to have these, like, see my own father, how he works professionally, but also my wife, who's an absolute boss, and then my brother, who he's my younger brother. I never call him my younger brother anymore, but just being able to work professionally with all of them is like, okay, I could retire now and be like perfectly content, because how rare is it that there's no crazy family arguments? I mean, we definitely had our arguments about Aero, but we still all love each other. So anyway, going forward with him, one of the stipulations was, hey, we're still the Aero OGs. Can we still work for Hint? And they said, absolutely. That's what we were hoping for. And so Kyle's one of their head engineers. Danny is the chief of, she doesn't have a title, but the whole everything within the EMR realm within Hint. And then they asked me to be their medical director. And so our Aero family, they're not getting rid of us. We're still going to be around. We're still going to be pushing to push that rocket to go even higher and even faster.
Amazing. And I definitely, myself, as well as many of the listeners, will be excited to see what happens next month, next year, and the next 10 years. So I love it. Now, when you talk about family, another thing that I want to highlight is that you are part of the Nextera affiliate family. And I believe, if I'm not mistaken, you were the 100th practice to join. So it's like this magic number of 100 is just is good juju all around for you guys. So how, because again, Colorado is a different place in terms of DPC in Colorado versus another state. How did you find Nextera's value proposition to be helpful, and how has that manifested in your practice at Strive Direct Health?
Yeah, that's a great question. I mean, Clint reached out to me, the head honcho of Nextera, for those who don't know. He reached out to me right when the sign went up on the door that a new practice is coming. He was like on it. And I didn't have the mental bandwidth at that time. I literally took a call with him while I was on the L&D floor, because that's the only time I had, like 7 people laboring. I was like, I guess I'll just pick up the phone real quick. So goes Residency sometimes. And I was like, this is Nextera is awesome. First of all, we're not even open yet. It was so early. Second of all, like I don't have the mental capacity to do my thing and like see if it would be something that would be worth it. And so time went by, we saw each other at conferences, we chatted. Anyone who knows him, I mean, I could listen to him talk forever. I love that man. But then we reconnected about Nextera specifically a few months ago. He reached out and said, hey, there's a need in your area, because he has a few affiliates that kind of are on a perimeter from where we are in Erie. And so I said, hey, I still want Strive to be Strive. I don't want to put a big Nextera sticker on my door. And he said, oh, no, absolutely, we're not going to do that. So it's been great. It's the whole reason I pulled the trigger on it was I wanted to, the DPC thought is, how can you provide as much value as you can for these consumers, these patients? And how do you, in my mind, I want to be able to offer as much or broaden the net of who can come to Strive. And so he has a few employers in the area that have a lot of employees that live in Erie. And so when he showed me that, I was like, oh, well, I want to be able to at least see those people, those humans, when they need to be seen. And so, yeah, there was a no-brainer. I mean, there were no finances talked at all. I just said, yeah, I'll be an affiliate. Absolutely. These people need doctors. And we're in an area that has a few doctors, but definitely is overpopulated with people and needs more doctors. And so I said, value proposition, let's do it. Why not? I didn't know we were the 100th. I should have he should give me a plaque or something. Maybe I'll text him and ask him for a plaque. But
Awesome. And Dr. Kyle Hampton had mentioned this, and he's in Fort Collins, Colorado. But for those people who have not listened to Dr. Hampton's episode, when you eventually did get to the pricing point, working with these employees of employers locally, can you tell us a little bit about how that works? Do you set your price? Does Nextera set the price? How does that work when patients sign on to your practice? And is there a certain quota that you have to have to become a Nextera affiliate in terms of number of patients who join your practice per employer?
Yeah, so no quota, and pretty much Nextera sets the price. Depends. I don't want to say any numbers out loud in case anything is whatever, but they set the price per head for adults and kids. It's pretty simple. And then if a company contracts with Nextera, then Nextera gives that company a list of all the physicians around where their employees live, and the employees can pick which physician they want to list as their PCP. And so in our area, it was like right when I signed up with Nextera, we had a dozen or so that were like the next day said, "Oh, I want, they're right next to us. We want to sign up with them." And then Nextera just basically writes Strive a check every month for however many heads times the price. And then obviously they have their administrative side of things. That it makes it super easy for me as a practice because I don't have to manage the company, invoices, all that stuff. We just see patients, which I love running a business, but sometimes I just want to see patients too. So
And in terms of onboarding a Nextera affiliate patient versus a patient who comes from off the street, how do you manage the onboarding of each of those patients in terms of your clinic when they show up to sign up at your practice to their first visit? How does it work, and is it different between those two populations?
yeah, so a patient off the street, if you will, we just give them the sign up link. It's on our website, and that just builds them a chart in Aero, and we just confirm them. And they're part of our normal age-based tiers and everything. And then a Nextera patient, that person tells their boss, or they tell Nextera, they'll have a Nextera account, say, "Hey, I want to go see Dr. Brown or Dr. Schuster in Erie." And then we get a notification from Nextera, and it's actually through Hint. They have the whole, so we have a Hint account as well, to where that's where all the Nextera patients live. And then we just build them a chart in 2 seconds within Eros, and we can have their medical record. All of the finances go through the Hint Nextera account. So it's a little bit different, but it's not hard to wrap your head around at all.
Well, especially when integrations they're being thought of before a patient signs on. And so the integrations definitely help make the administrative work less of a burden, I feel. So that's awesome. And if your patients were to go to another state where a Nextera affiliate is there the reciprocity in other clinics under the Nextera affiliate agreement?
I believe so. Yeah. I think they can. I don't know if going to any doctor they want is what is pitched to them, but if they move to another state, they can absolutely just say, "Hey, I want to go see Dr. Marial." But if they're visiting, I'm pretty sure they can just go to a Nextera clinic and be like, "Hey, we're visiting," and then it's all worked out on the back end.
Because you've been in this amazing community from such a young age in medical school, even, I want to ask in terms of words of wisdom for other people going into the future in terms of pitfalls or things to make sure that they protect, whether that be family time and how to protect that family time, or how to strategically avoid certain pitfalls that you might have experienced. What would you say to those people?
Yeah, that's a fantastic question. First thing that comes to mind is you make time for what you love. That was, someone told me that, I don't know who, probably some famous person said that or something, but that was eye-opening to me, that work will take the time that you give it. Family will take the time that you give it. You get out what you put in. There's a great book, How Will You Measure Your Life, it's a Harvard business professor who's retired now. And he said, he goes through all these Harvard business reviews and everything and cases about how you can't harvest relationships when you're retiring at 62 when you haven't farmed them for the last 30 years. And so I'm a people person, I'm a relationship person. Personal connection means a lot to me. And so making sure that you focus on what actually matters and you make time for what you love. I love Strive, I love DPC, I love Aero, I love Hint. We're all part of the Hint family now. But if it ever came down to it, it's my kids first. I mean, there's no question about it. And so the advice I would give is go for it. You do you, first of all, but find that harmony and be willing to adjust that harmony. Sometimes you're in a minor chord, sometimes you're in a major chord, sometimes you have the capo on. I don't want to pretend like I know music. I don't even play the guitar, but it's a fantastic analogy anyway. And so it's making sure you stay in that harmony, because then everything else is easy. Like sometimes you're working 15-hour days and that's fine, but don't make that for 30 years. Sometimes you're 15-hour days at home, but that would throw everything out of whack. It's like you have to find that harmony of where everything fits. So long, convoluted answer, but take it for what it's worth.
Absolutely. And what I love about that answer in particular is it will mean different things to different people at different times in their lives. So I think that's awesome. Now, in terms of finding your harmony, what is in the future for Strive Direct Health going into next year?
Oh, Who knows, really, right? I still do a lot of the moonlighting and ER work. I'm hoping to back off of that while Strive grows. Obviously, I mean, this is one of my babies. I have a lot of babies, I guess, but I really want to see Strive. I mean, it already is self-sufficient and it's already growing at a nice linear, sustainable pace. I don't think a hockey stick type growth would really be sustainable for us, especially because Sarah and I both wear so many hats. But I would like to see it continue doing that, just that cadence every week, every month of changing people's lives. And sitting here, I'm sitting in my office right now, sitting here talking to people and them seeing the light of DPC, if you will. That's why I love coming in here every day. I love it, and I can't wait to do that more and more.
Well, thank you so much, Dr. Brown, for joining us today.
Absolutely. Thanks for having me. This is awesome.